people of Columbus and our state have been through a lot. The global COVID-19 pandemic has infected thousands and, sadly, taken the lives of far too many. Some of us have lost our jobs, were laid off, or had our hours cut, or we probably know somebody who did. The virus and economic downturn have taken a toll on our neighborhoods, our families, our friends. This Central Ohio Worker Center video provides you with important information about laws and resources available to help workers and residents in Columbus get through this pandemic and the tough economic times to follow.
Hello, my name is Lisa Oakes. I'm the Chief Executive Officer of the Ohio Nurses Association, a professional association and labor organization that speaks for over 180,000 registered nurses in the state of Ohio. Nurses are frontline patient and community advocates. Throughout the pandemic, nurses not only cared for patients and provided comfort to family members, they've also called for workplace protections that benefit all working people.
The state of Ohio has implemented some workplace procedures to protect individuals in the workplace. For example, businesses must follow industry-specific prevention measures, which includes wearing masks, social distancing, or the installation of barriers in the workplace, among other safety measures. The requirements for your industry can be found on the Ohio Department of Health's website. All of us can take action to protect ourselves at work and in our community. Past generations of Americans made great sacrifices for one another. They went to jail for the right to vote. They lost their lives in World War II in a fight against fascism, and they struggled for civil rights and equal protection under the law. COVID-19 has brought considerable disruption to our lives. What's being asked of us at this time in American history is that we wear a mask in public and follow social distancing guidelines. By doing our part, we can help reduce the spread of the virus, save lives, protect one another and our jobs, and help the economy recover.
My name is Rick Lucas. I'm a registered nurse and president of the Ohio State University Nurses Organization. People across Central Ohio and our nation trust and support nurses. We have been on the front lines of the pandemic like so many other workers. As we continue to provide care for you and your family members, you can show your support for us and other working people by wearing a mask, washing your hands, and practicing social distancing. COVID-19 is the most serious health crisis of our lifetime. It's important that we recognize COVID-19 as a serious threat to our workplaces and our communities. Many people who have become infected with COVID-19 report only mild symptoms, but don't let that give you a false sense of security. It's only part of the story. People without symptoms can still spread the virus. As a nurse, I can tell you that some people do become very ill and die from COVID-19. We know that people who have certain serious health conditions are at a greater risk of becoming severely ill or dying from a COVID-19 infection.
Some serious health conditions are treated as disabilities under the law. Individuals whose serious health condition places them in the CDC's high-risk category may be entitled to a reasonable accommodation at work.
The care and community education that Rick and his fellow nurses are providing to patients, families, and communities is something that will be written about in the history books. If you or someone you know gets sick or exposed to the virus, follow the instructions of your medical provider, the Franklin County Health Department, the State of Ohio, and CDC guidelines. These may include isolating yourself if you are infected with the virus and quarantining yourself if you have been in close contact with someone who has contracted the virus. There are laws and benefits available to protect and support you through these tough times.
COVID-19 is not only a public health crisis, it's an economic crisis. There are laws to protect you and economic resources available to assist you during the pandemic.
Hi, my name is Hannah Halbert. I'm the Executive Director of Policy Matters Ohio, and a member of the board of the Central Ohio Workers Center. There are laws that provide workers with some protections during the pandemic. One of those laws is the Family and Medical Leave Act, or FMLA. The FMLA may provide some employees with job-protected leaves. Under the FMLA, eligible employees may receive up to 12 weeks of unpaid leave for a serious health condition that prevents them from working. COVID-19 may qualify as a serious health condition if you're incapacitated due to COVID-19 symptoms or complications. This is a fact-based analysis that requires you to speak with your doctor and get medical documentation regarding your serious health condition. Your employer may require your doctor to fill out certain forms or sign off on certain documents, so you should check with your employer regarding the necessary steps to apply for FMLA. You may also be eligible for leave under the FMLA if you're required to care for a close family member, a spouse, son, daughter, or parent who is incapacitated due to COVID-19. As a general rule, the FMLA does not apply to employers with less than 50 employees. Other eligibility requirements apply. There are separate rules for school employees.
For more information about the FMLA and COVID-19, review the United States Department of Labor's COVID-19 and the Family and Medical Leave Act question and answers document. If you believe your rights under the FMLA have been violated, you can file a complaint with the United States Department of Labor free of charge, or file a private lawsuit to enforce your rights. Your employer cannot retaliate against you for exercising your rights under the FMLA.
The pandemic has had a terrible impact on working families, and recent changes to federal law have been absolutely necessary. For instance, under the Families First Coronavirus Relief Act, or FFCRA, a law passed by Congress in late spring of 2020, provided expanded family medical leave for specific COVID-related reasons. This expansion is available to eligible full-time employees of private employers with fewer than 500 employees, and most government employees. Under the expansion, covered employees are entitled to 12 weeks of paid leave if the employee is unable to work or telework because they need to care for a son or daughter whose school or place of care has been closed due to COVID-19. Or because the child care provider is unavailable due to COVID-19. Part-time employees can also take up to 12 weeks of leave, paid as if they worked for the number of hours they are normally scheduled to work over that period. Under the law, the first 2 weeks of leave for full-time and part-time employees can be unpaid, but employees can use accrued paid leave, like vacation or sick pay, through their employer, or new emergency paid sick days, which are also available under the FFCRA. After 2 weeks, employees are generally entitled to 2/3 of their regular pay, but no more than $200 per day. A couple of other points. Under the FFCRA, if a school's physical location is closed for COVID-19 related reasons, it is considered closed for the purpose of paid sick time and paid leave, even if some or all instruction is still being provided remotely. Also, if an employee is enrolled in health insurance through their employer, the employer cannot terminate health insurance benefits when the employee is taking paid leave or sick days under the FFCRA.
The FFCRA also includes up to 80 hours of paid emergency sick days for full-time employees. Part-time employees are included and can take up to the average number of hours they work in a 2-week period. The permissible COVID-19 reasons for taking paid leave include isolation and quarantine orders, caring for a household member who is subject to an isolation or quarantine order, quarantining on the recommendation of a medical provider, experiencing COVID-19 symptoms and seeking a medical diagnosis, or caring for a child whose school has been closed or child care provider is unavailable because of COVID-19 precautions, among other reasons. If you are taking leave to care for someone else, sick leave pay will cover up to 2/3 of your regular rate of pay, up to a maximum of $200 a day. If you take sick leave to care for yourself, sick leave pay is paid at 100% of your regular rate of pay, up to $511 per day. The FFCRA permits some employers, like healthcare providers, to opt out of the law, and small business may also apply for exemptions. The FFCRA is set to expire on December 31, 2020, unless the federal government extends the law. Therefore, if you're watching this video after December 31st, 2020, some of these leave and sick pay provisions may no longer apply to you, depending on whether Congress has extended the FFCRA or passed a new, similar law. If you have any questions, reach out to the Central Ohio Worker Center and we can help you decipher the current status of the law.
Hi, I'm Columbus City Council President Pro Tem Elizabeth Brown. There is still a tremendous amount of work needed to help members of our community who are struggling to pay bills and stay safe. We know that an equitable recovery starts with meeting the needs of workers, especially those who have been impacted most. Council unanimously passed a resolution supporting an Essential Workers Bill of Rights that promotes living wages, health and safety protections, universal paid leave, affordable child care, and proper job classification and quality standards that recognize the dignity of all work. Council established a cap on the fees delivery companies can charge local restaurants. We protected workers by ensuring that those services do not reduce pay or garnish tips from delivery drivers in response to the cap. We want to keep the money that folks are spending locally here in our community to help our businesses survive, to pay workers, and to keep people employed. And I am proud of the Right to Recover program Council launched to offer workers the financial resources they need. About 2 weeks of full income replacement, up to $15 per hour, to take time off, isolate, and recover following a positive COVID-19 test. Giving workers the security they need to get tested and follow safety recommendations during this pandemic protects their health, their family's health, and the health of everyone in our community. Our neighbors, our friends, and our families have been hit hard by this pandemic. But by working together and continuing to put the needs of workers first, we can ensure that everyone in our city can find the safe working conditions they need and be treated with dignity and respect on the job.
It's important to know that if you are unemployed or your hours have been cut due to COVID-19, you may be eligible for state or federal unemployment insurance benefits. Benefits are no substitute for a good-paying job, but unemployment insurance benefits can be a big help when you have lost income because of the virus. If you have lost income because of COVID-19, apply for benefits. You can apply for benefits through the website of the Ohio Department of Job and Family Services at unemploymenthelp.ohio.gov or calling 877-644-6562. If you have questions about filing for unemployment insurance, go to the Ohio Department of Job and Family Services website for information. On the website, you can review frequently asked questions and file for state and federal unemployment benefits. Ohio unemployment insurance benefits are normally available for 26 weeks. Currently, employees may be eligible for additional weeks of benefits due to certain temporary changes in the law. Again, remember that the law in this area keeps changing, so you should double-check its current status online or contact the Central Ohio Workers Center, and we can try to help you get answers to your questions.
In the state of Ohio, eligible workers may be entitled to unemployment insurance benefits if they are required to isolate due to COVID-19 infection or quarantine because of exposure to a person with COVID-19. This is currently the case, but the law may change based on the status of the pandemic and decisions by elected officials. Eligible workers may also receive unemployment benefits if their hours are reduced, their place of employment closes, or they are laid off. You can check eligibility requirements online before you apply and call the Ohio Department of Jobs and Family Services with any questions you may have before you apply. Note that the department holds you accountable for any errors to your application, so you'll want to understand the application fully before signing off on it and submitting it.
Individuals who are not eligible for regular benefits may be eligible for unemployment insurance benefits through the Federal Pandemic Unemployment Assistance, or PUA program. If you're watching this video after December 26, 2020, please double-check the current status of the law. If you need assistance with understanding the current status of the law, you should contact the Ohio Department of Jobs and Family Services.
The Central Ohio Workers Center has made additional materials and resources available on its website at centralohioworkerscenter.org. Most importantly, we want to work with you on the workplace and community issues that matter to you. Please join COWC today or register for updates so we can stay in touch.